You're so welcome. Thank you for joining us. I think everyone has a seat, so there's no need for me to do my usual thing of there's a couple of extra spaces at the front. Great, we're all good on that front. So the plan is for this afternoon, I will introduce our incredible panel of speakers. Then I will ask them some questions. Then hopefully you will ask them some questions too. And then we will have some refreshments at the end. So that's the plan. But before I introduce our guests, just a quick word about who we are and why we are here. So the Coalition for Global Prosperity exists to champion the United Kingdom as a force for good in the world. And we believe that an effective aid budget working alongside an active defence and diplomatic strategy helps keep the UK at the forefront of saving lives, alleviating poverty, and bringing freedom, security and prosperity to those who need it most. And we are here today to launch our latest report, which you should all have on your chair, but I'll show you just in case you need reminding. And it's called From Expertise to Influence, the United Kingdom's Soft Power in Global Health. And we really do have an extraordinary panel of speakers. If I were to read out all their accolades and many career achievements, we would be here all afternoon. So I'm just going to cover the basics. To my right, the Right Honourable Sir Sajid Javid, MP, former Chancellor of the Exchequer and Health Secretary. To my left, the Right Honourable Julia Gillard, former Australian Prime Minister and Chair of the Wellcome Trust. And to Julia's left is Jo Sorrell, Managing Director at the Bill and Melinda Gates Foundation. So, to kick us off, Sajid, I'm going to come to you first, if I may, and then Julia, I'd love to bring you in. Having worked on this agenda in a number of different roles across government, what are your reflections on why the UK's leadership in global health is so important?
Good, thank you. Congratulations on the report, and thank you for having me. I think UK leadership on international development, which of course health is a really important part, but also economic development, education, and all of that as well. But I think that is important because first I think it's just it reflects our values as a country, and I think there's good in certainly throughout all my time in politics, as there's been good party consensus on this, is that all the major political parties take our international role very seriously, because ultimately I think that reflects the values of the British people. But also, I think UK leadership in this area is important because it's if you take a more, let's say, more sort of, realistic view, if I call it that, it's just in our national interest, that we help other countries, developing countries, with really important areas like healthcare, like education and others, because if those countries do not do well, if the people in those countries do not do well, then ultimately it could also just become a problem for us on our doorstep. And when I was Home Secretary, I could see whether it's through the migration challenges and things like that. I can see what that's like as well. So it's our values, but it's also in our national interest. And I think also, if I may add, I think if I look back, and the UK over many years, successive governments has played I was going to say outsized role, but let's say punches above its weight, right? I think as a medium-sized power as we are, if you look at our involvement in global health in particular, whether it's sort of our funding commitment, which is substantial to the WHO, our sort of our founding roles in some, and funding roles as well in some major newer organizations like the Global Fund, like CEPI, Gavi, that's something where the UK is not just through funding, but through thought leadership, through expertise, has been playing for many years a big role. I saw for myself when I was Health Secretary, particularly at first hand, especially obviously during the pandemic, how much difference that made. And a lot of the things that were making a difference, they were routes that we laid down and expertise that we had within organizations well before the pandemic, and it really played off during the pandemic. And then the last thing that just comes to mind, if I may say, is I think the UK also is in a position as a country that I think we have this great convening power, and you talk about it in your report, is that we can really bring people together using our sort of diplomacy, our network, our historical contacts, and in a way I think few other countries can. And again, if I use the pandemic as an example, certainly lessons learned from the pandemic, if you take a country like China, obviously there's a lot we don't agree with on China, but China is a country that cannot be ignored in terms of dealing with some of the world's biggest challenges, and obviously that's health, but also things like climate, arms control, and other issues. But when it comes to health, think about the last pandemic and how it all began in China, and when the next pandemic comes, and it's probably going to be a lot sooner, I think, than most people realize, and lots of medical health reasons, scientific reasons for that. It may well begin from China, and there's reasons to think that as well. And I think you've got to have a good sort of cooperation with countries like that on things that matter to all of us, things that don't recognize international borders, like health. And I think the UK, especially compared, say, to the US, for example, I think is in a really good position to sort of bring countries together and sort of knock heads together in all our interests.
Thank you. Julia, if I may, why is the UK's leadership in global health so important?
Well, very happy to answer that question, though of course I've got to say first up that anything the UK does, obviously Australia does better. So having reserved that ground for the folks back home, I'm very happy to talk about the UK's leadership. I actually, in my post-political life, mainly started intersecting with the UK government in the education stream. I was chairing the Global Partnership for Education and dealing with a variety of ministers and with what was then DFID on education policy. And it was quite clear to me that whether it was girls' education or a series of other challenges in the education area, the UK was at the forefront in the advocacy and in the policy thinking, and that endured across a number of prime ministers and was a big theme of what was happening in foreign aid. I've more latterly come to this position at the Wellcome Trust. I started chairing in April 2021 and have come to learn more about the UK's profile in life sciences and the way in which it can use that depth of scientific research and ability to make a difference in the world. And we see that from the perspective of the Wellcome Trust in all sorts of ways. We too are trying to increasingly fund in a way that brings global collaboration around some of the toughest health challenges. So recognising that not all expertise lies in the Golden Triangle here in the UK, but strong partnerships with low and lower middle income countries for research capacity can then give you the foundation stones of collaborating around what can be game-changing new innovations. I mean, one thing we are working together with the Gates Foundation on, for example, is a new tuberculosis vaccine. So those things obviously save, multiple millions of lives. When I look at what's going well here, it continues to be the case that the research intensity and profile of the UK in life sciences is something to be very, very proud of. However, there are a series of challenges. We've obviously been living through an inflationary cycle, and inflationary pressures put pressures all round, including on those who are trying to do the life sciences work and research. Against that backdrop, funding certainty is really important. That's true in terms of direct funding for research, but also what is done through the overseas development assistance to then take health innovations to the world. And whilst the UK can be very proud of its track record in overseas development assistance, there was a period when cutbacks were being made. They were announced in 2020. Some of those actually jeopardised clinical trials which were then in progress. And as a philanthropic fund, we at the Wellcome Trust needed to take some decisions about whether we would step in to ameliorate the impact of some of those cutbacks, and they're not easy choices for us. At the end of the day, we want our work to be additional to what the UK government is funding, not a substitution pot. So funding certainty really matters. And I think that there are also a series of issues around interconnections with the world and who gets to come to the UK and how easily they can come here. And so, you know, things like visa charges, immigration health charges, all of those things that, you know, are understandable policies from government, and governments around the world do them. But when we're looking at being on the global network for life sciences research, the more you can smooth the exchange, the pathways that bring people together, the better. So there are some things to think about as we move forward through what will inevitably be an election year, and when both sides of politics, and I think both sides of politics are very committed to the UK's status as a sort of life sciences superpower, both of them using that language, putting out policy statements in that sort of slipstream. But there's some very specific things to be thinking about for each side of politics as we move forward through this election cycle.
Thank you. Joe, I'm going to come to you in a second if I may, but first, Sajid, my next question is, how can we create the best possible environment for UK science and maximise its impact?
I think, you know, as Julia's just said, I think that already in the UK we do have, for example, on life sciences, a sort of a well-established sort of cross-government policy, set of policies that I've been very involved in, both as Chancellor and as Health Secretary, and that's good. And I think there's also, again, good consensus around that, political consensus, and that's important because Julia just said as well, we're in an election year, and government might change, and businesses and especially investors sort of need to think about that. But I would think even if the government did change, I think there would be a good deal of consistency around this whole sort of life sciences sector, and indeed our overall approach to global health. But things can be done to make improvements. I mean, you know, and your organisation has talked a lot about the cut in international aid that we've seen in the UK. I think at around 0.5% of GDP, it's still one of the largest of any country, but it obviously is less than where it was before. And we all know the reasons for that, but I think one thing that can help, and again, I think you mentioned this in your report, is having more consistency over spending and doing it more long term. So, you know, I've seen so many organisations that I've worked with in my time in government where often they basically say to you, look, you know, I'd rather take, you know, say 100 million, 20 million a year over 5 years to help me, rather than you give me maybe 150 million, but it's up and down and I can't predict it and stuff. So having that stability in funding for the long term, I think can make a difference. Also, I think that one area that we can just do so much better in, even though we've tried, but I still think there's low-hanging fruit there, and that is better cross-government cooperation. So the approach we have is cross-government, and you do have different ministers from different departments involved, but if you think about it, you know, I think pretty much every single government department, so not just the obvious like health and treasury and FCDO and stuff, they all have a role to play when it comes to UK life sciences and global health. And we don't always, as a government, I think, coordinate that and do that well enough. So a point was just made about visas, for example. You know, so when I was Home Secretary, you know, that was a policy under me and things, and I did introduce like the high talent visa for universities and things, and I think that's helped in research. But it was as part of our life sciences strategies, but it's only because I took a serious interest in life sciences when I was Home Secretary. It wasn't anyone came to me and said, look, can you help? If I think other departments that I've run, you know, the DCMS, you know, the culture, media and sport, if I think about technology, strategy, digital, especially with AI and how transformative AI is going to be in every part of life, but especially healthcare, and I think especially for developing countries. And already, I know in the recent AI summit, the government announced the sort of AI for development. I think they called it a program. But again, better coordination across government, I think, can help with that as well.
Thank you. Joe, can I ask you the same question? How can the UK best create a solid environment for science?
Great. Well, first of all, thanks to CGP for having me here. Congratulations on a great report, fantastic forward that Sajid put together. Happy World Malaria Day. I'm sure it was a big fixture on all of your calendars. It's a good time to celebrate, I think, some of the progress. I think it's particularly appropriate just given how much involvement the UK has had in malaria, and in particular the great progress that we've made that often isn't reported as much. Look, I think a lot of the reasons for why the UK is such a great home to innovation and research have been covered. I mean, from the Foundation's perspective, the UK is the largest recipient of research and development grant funding outside of the US because it's the depth of the institutions that are here and the commitment to thinking about health, not just within the UK's borders, but on a global basis. It's been a really impressive run. As Julia talked recently, there's a great pharmaceutical life sciences industry here that's led to a lot of amazing breakthroughs. M72, this tuberculosis vaccine, is one that we think is particularly promising. You know, when you think about a TB vaccine, the one that maybe, I think they've stopped here since the early 2000s, but the one I got is a 100-year-old vaccine, BCG. So it's about time that we think about tools for conditions like tuberculosis that, you know, most of us, most people won't ever really face, but it still kills, as of I think 2022, 1.3 million people annually. So I think that's, for me, a great example for what makes the UK so special, and why it's important to continue to support this, and why I really think it's great that this report has come out and talks about the dividends of soft power that the UK accrues as a result of investing in global health. And it's, for us, the collaboration that can exist across different sectors, from government to the life sciences industry, to thinking about academia and its role at institutes like the Jenner Institute, the Wellcome Sanger Institute, and I think philanthropy as well. I mean, it's one of the reasons why the Foundation chose to have its office, when we thought of a European office, to be based in the UK, because that kind of collaboration is unique. It's what separates the UK from a lot of other countries where we're working. And I really do think it's something that you can have a really strong case for those dividends, soft power. And we've talked about, I think Sajid did the convening power. When you go back about 10 years, it was the UK that brought together people from around the world to have these global summits where tangible, huge commitments were made on global immunization, on family planning, on nutrition, on governance and transparency. It's the UK that I absolutely agree, has this outsized influence in being able to draw people and have a disproportionate influence on the policy agenda on many issues, including global health. So, that's for us the big appeal, and that's the reason why we're going to continue to make the case wherever we can, and that the UK's investment in global health is a hugely important investment, and something that's definitely generating returns.
Just while I have you, Joe, one of the case studies that the report focuses on is malaria. And can I ask you, what's your thoughts on how likely it is that we'll be able to eradicate malaria in our lifetimes, and what else needs to be done?
Well, we're nothing if not optimistic, and I do think there's a strong case. I think people are careful about setting dates or targets. I think there's, I'm involved in the effort to eradicate polio, where we're 99.9% of the way there, only 4 cases this year, but these things are really, really hard. I mean, it's taken longer than we anticipated. I think malaria, after we get polio done, will be the next one we should be setting our sights on. We have fantastic tools, and again, we have those tools because of a lot of the investments that have been made by the UK in UK institutes. And not just in London. I was in Liverpool recently looking at some great bed nets. I was at Imperial College recently looking at some really next generation ways that they're tackling how to drive down mosquito populations and how to breed mosquitoes that won't transmit the malaria parasite. So I think we have a really good opportunity to do this in, say, 15 to 20 years. But I think given the tools that we have today, and we have 2 new vaccines, by the way, both from GSK, one called RTSS, another that just came out called R21, that are definitely better. Well, they're the first 2 vaccines that are out there. They're still not where we would love them to be in the future. You need to take the R21, I think, 4 times over 14 months, and so it's not quite, but it's 70% effective in that case. And we have good bed nets, we have good drugs, a lot of the tools that we need, but we're going to need more, and we're going to need a more sustained effort, and I think that's where the predictability of funding is really important too. If we put these bedrocks in place where we make sure that we do everything we can with the existing tools, but have some resource to help develop new tools and make sure that support is sustainable over the next 15 to 20 years, I think we've got a really good shot, and that would be a hugely historic milestone for humanity.
I want to bring in the audience, but one more question from me for now, and I'll start with you, Julia, if that's okay. At the Coalition, we've been working with parliamentary candidates who are standing at the next election or the one after that. And some of them will definitely be future leaders of their party because we've identified them and they're excellent.
Can they put their hands up?
Yeah, that's all, because I can't point them out because it'll be favouritism, so yeah. But they can all do it. What would your message be to candidates in this election year thinking about this agenda?
Oh, well, I think message number 1 would be, stay hydrated, eat your vegetables, try and get a little bit of sleep, because it's really hard. And people underestimate that from the outside. It's really hard. And when you're in that cycle of first trying to break into politics, it's everything. And so it's, kind of every waking moment, even if you're, doing the job that you do to make sure that you've got an income to get by even while you're campaigning, there's some part of your mind that is focused on the election ahead, and all of your family stuff and stuff with friends becomes, distorted around mobilising them to help you with the campaign. So I know it is really, really hard. And the essence often of people putting themselves forward for election is that they're people who care really desperately about their own local community, often the place that they grew up, or maybe a place that's become home to them at some point during their adult life. And they're moving through that community, seeking the support of that community. And so the issues that come to them all day, every day, are the local issues. Why are there potholes in the road? How come the local hospital's not going as well as it should? Why is it so hard to get a GP appointment? Why isn't my child's school at a better quality than the one my child's in? And you need to be across all of those issues and responsive, because that matters and your community is relying on you to do that. But when you get there, you necessarily are engaged still with those local issues, doing your constituency work, but you need to turn your mind to the big picture issues, to think about the tax and transfer system, the universal platforms, the future of the NHS. How do you manoeuvre those platforms to create health and better equality? And so your eyes and your mind are much more on these bigger picture questions. And amongst those very big picture questions is, what is the role of the UK in shaping the future of the world? What is the nature of the planet we want to share? How can we live with its planetary constraints in terms of climate change? How can we maximise peace and security and prosperity for people all around the planet? Because if there's one thing that we know from this age, and if we didn't know it before, COVID certainly proved it to us with a very, sharp shock. Gone are the days that you can think that something that happens way over there somehow doesn't matter to you. We are too connected for that now. It all matters. And whether it matters because of a pandemic, whether it matters because of the outbreak of war, whether it matters because of people movement, whether it matters because we've only got one climate, one planet, and what one nation does matters to all of us. And so you increasingly have to be thinking through where you stand on these big picture questions. And once you work that out, then how do you go about shaping global discussion in a way that reflects the values and the outcomes that you've worked your way through, and being a noted, thoughtful, resourceful, multilateral partner, prepared to work intellectually but also to pledge resources through overseas development assistance, is all part of the the currency, the currents that put you into those global dialogues and enable you to be a shaper of change. I mean, to put, there'll be an election this year sometime. I don't know the date. We were discussing it before. I'm not sure any of us know the date. We'd certainly share it if we did know the date. But whenever it is, people will, there'll be government setting up time, whether or not government changes, there's always set up time, and then we'll emerge next year. And it'll only be a few short years, really, before it'll be the end of the Sustainable Development Goals, and we'll be into a new era. What are the 5, 10, 15 big things that as a global community we want to commit to each other that we're going to achieve beyond 2030? I mean, people in UK Parliament will have their voices heard on that. And so, being thoughtful and in that discussion really, really matters. Supporting overseas development assistance, supporting the policy work really matters. And I'd urge you to reserve enough time once you get there to be making a contribution on that. I'm not unrealistic enough to think you can take a lot of time now when you're campaigning, but once you're there, then getting your head around those issues and being there for them is a really important thing to do and will matter to the future of this country.
Thank you. Joe, come to you next.
Same question?
Yeah, your message for the ministers of the future. And shadow ministers as well.
Yeah, well, I mean, you're hearing it from the best here, so I don't know how much more to add. I would say there's a kind of give, do, learn construct that I would encourage people to think about, giving of your time to, really understand some of these issues. It can be a little bit daunting if you're not sort of in the development lingo and thinking about vaccines and diagnostics and all of these things, but I think there are lots of resources, and it's an incredible time to be involved. It brings innovation together, it brings leadership together, it brings a lot of things that I think are helping the UK think about how to confront issues within its own borders while also solving a lot of global challenges. I would say the Coalition for Global Prosperity is a great organization, so getting active. I've been to a few of these kinds of events, including with candidates, and they're really fantastic in terms of bringing people together and talking about the issues of the day and really surfacing some of the challenges. When you think about development assistance and what the UK can do, it's a really spirited debate, and it should be. And we should be thinking about how much the UK at a time of tough fiscal uncertainty should be giving. I think there's a strong case, but that's the kind of thing that resources organizations like CGP can help with. And learning, I think the best thing to do is to travel and see some of these issues and some of this work firsthand. It's one thing in a room like this to talk about progress and the millions and the billions. It's another thing to see firsthand, what British generosity looks like in the eyes of a family, a village that's been profoundly impacted forever in terms of their ability to not just survive but thrive because of the generosity and because of the things that countries like the UK are able to do. So that's the message I would leave.
Sajid, I'll come to you. Can I just add something else as well? You mentioned at the beginning values. So could I ask you to say a word about those two in your answer to our aspiring future leaders?
Yeah, look, I would say, so when I talked about values, obviously there's the what I think is a value of Britain. You're wanting to help others abroad has been there for a long, long time, and as I said, I think it's reflected in all the major political parties, and that's because that's where broadly the British people are. But that's where I thought I would focus my remarks, in that there's a let's say amongst the population there's a group of people that are very, very supportive of overseas international development aid and stuff, and they don't need to be convinced, right, about the importance of the kind of things that we're talking about. There's a group of people at the other end, small group I think, but still important, where they'll probably never be convinced, right? You can go on about it, and I've met people like that. You can go on, say whatever you want. They just either are not listening, don't care, or they just have a different set of values, and that's ultimately that's their decision. But there's also, and this is the important bit, I think, there's a group of people that are in the middle, right, where they know about the importance of this, the kind of things we're talking about. But also they can see that money is tight. It has been obviously for a long time, but I think particularly so with all the economic challenges that we're facing, many countries are facing, and I think sometimes they can be a bit sceptical. And I think what needs to happen there is that parliamentarians, whether they're parties in government or not, if they agree with the importance of global health, they need to make the case. And I think they need to find the right way, the best ways to make that case to people. And some of that is through parliamentary work, like directly in Parliament. Some of it will be through media, and some of it will be in their local community. But find ways to illustrate to people that why this really matters. So just to pick an example, take something that that people will immediately sort of recognize as an issue: the pandemic. Right? There's not a single person in this country that doesn't remember the pandemic. Right? They didn't have direct experience, so they knew just how serious it was. And then when you're talking to people, just ordinary citizens and stuff, you're trying to sort of show them the importance of this agenda. Then sort of you can say to them, look, so the pandemic obviously was huge for our country. Where obviously the health impact, life impact, the economic impact. Do you think Britain would be in a better place for the next pandemic if we were working with other countries, perhaps those countries that are not able to protect themselves, say with vaccines and treatments in the way we are, or helping them detect a new virus, helping to maybe send some SWAT team in with other countries to try and deal with that virus early on, stop it from spreading. Maybe if we work with countries now to help them create vaccine production facilities with all the lessons we learned in their own countries or nearby other countries. I think most people agree with that. And then you can see, well, let's say if we spent a few pennies on that now, but it saved billions later, isn't that a wise investment? And I think you can the people will sort of nod along, follow that argument, and soon you'll find that they're in agreement with you, and then you're in a good place and to build from. And that's what I think parliamentarians can do, and I think some of them do that today pretty well. Some of them believe everything I've just said and the importance of this, but they just don't think they can make a difference, or they're not good at articulating it. And my suggestion for CGP is so good at this is that you guys should hold a session for parliamentarians about how they can sell this and in words that will translate into action on the street.
Thank you. We certainly will.
Yeah. There you go.
Thank you very much. Great. Can I have a show of hands just to gauge interest? Yep, don't be shy. Great. All right, let's go. Let's do two at a time start. Resham, then Zander.
Thank you very much. So what can the UK do in terms of its soft power to push for and catalyse gender equality in terms of access to healthcare around the world? And on your point about the pandemic, COVID showed us the different impacts of health outcomes across ethnic minority groups. So how can we use data to better improve health outcomes both in the UK and around the world?
Thanks. Zander Walcombe. I'm with the Pandemic Action Network, so I was very pleased all the chat about pandemics, and also with the Eleanor Crook Foundation working on malnutrition. And my question was really, firstly, I think the report's great because especially chapter 2, like you were saying, Sajid, it gives examples. And I feel that soft power is like a elusive concept. And so if you can actually give tangible examples, that's very, very helpful. But I think there's two different audiences for whom you do need two different messages. And I was wondering if you agreed that as far as the UK domestic audience is concerned, this is about like, this is good for Britain, this is good for the world. It would be great to know all the jobs and like the economic development benefits that are had in all these different constituencies. And if all of those MPs had that data, or the candidates, that would be helpful, because the Americans are really good at it. You look at malnutrition, they're like, yeah, Georgian peanuts are saving lives. We don't do that because that's not British. But there is something about being proud of what we're doing and exporting that soft power. But at the same time, there's also this neo-colonial element to it, that it's not just about all this money going into our academic research institutions. It's about different ways of bringing power to the countries that we're trying to work with and partner with differently. So how do we do those two things at the same time? And then just specifically, we need more examples of what this soft power looks like internationally. So there is hopefully going to be a pandemic treaty agreed next month at the World Health Assembly. That's a really important example of where the UK could be doing more on soft power. But when it comes to pandemics, you said everyone remembers it, but politically it feels like everyone's forgot it. So in terms of soft power, how can we use that to put pandemics higher up the agenda?
And let's just do one more. Pimana, sorry, I'll come to you, sir.
Peymana Assad, the Labour Foreign Policy Group. My question really, I mean, it's pointing to what Julia said around looking at things from the outside. And obviously we see, you mentioned gender equality. Afghanistan, for example, bans girls from an education. You got polio both in Afghanistan and Pakistan. We all know that education helps global health outcomes, especially in the global south. What do you think the role is for institutions or foundations working on global health in their role in advocating for girls' education, for example, and other issues that actually help advance global health outcomes?
Who would like to go first? And I'm not expected to answer all three, so you can pick your...
Well, I'm happy to pick up on the gender equality and girls' point. I mean, you're absolutely right. I mean, we're obviously here talking about health, but I think, many in the audience who work in this community who think routinely about overseas development assistance know that and when you work in government too, I mean, people don't live their lives in silos. They live their lives as whole human beings. And we used to talk a lot, we possibly don't talk as much as we should now, about how making a difference for girls' education for adolescent girls has huge spin-offs across all sorts of other agendas, the health agenda, the reproductive rights agenda, the combating child marriage agenda. The statistics continue to tell us that if a girl finishes school, then she's, more likely to marry later in life at a time of her choosing. She'll have fewer children. The children she has will be more likely to survive infanthood. They'll be more likely to go to school, and they'll be more likely to be vaccinated. So tick, 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 tick. So I think when we're, conceptualising, and this always has to be co-created with the communities that it affects, but when we're conceptualising what needs to be done, we've got to think about it in a joined-up way. So that really matters, and I think foregrounding gender equality discussions, making sure that gender is a theme of everything we discuss, matters too. I mean, one of the things I've certainly seen happen in the as a result of the Millennium Development Goals and then the Sustainable Development Goals is we talk through one goal down and then we're not talking about gender or other forms of inequality unless we're specifically talking about the goal that relates to that, and we've got to be better at the cross-cut and better at the theming.
Sajid.
Yeah, I thought I'd pick up on the sort of racial equality point, or racial differences in healthcare, ethnic minorities, I think you used that phrase. And I think this is hugely important, and I think that it's not just in terms of international healthcare, but also in the UK. And my own feeling, I thought when I looked into this a lot more as health sector, I think it's been hugely neglected by countries, including the UK. Because if you think about it, most research into health, new treatments, medicines, most qualified, experienced clinicians and stuff, they're in rich countries for obvious reasons, and those rich countries are, mostly full of Caucasian, white people. Right? And if you think of the biggest health companies in the world, with a very few exceptions, they're all companies that are led by executives and others that are all white people. And so it's not a surprise that when they look at healthcare, they look at what works for white people. That's just the reality. That's how it works, right? That's where the money is. That's the money that they're chasing. That's the governments that are funding them and stuff. That's how they're thinking. So when we saw the pandemic, and this illuminated a lot of health inequalities that had always existed, and there were many, and one of those were around racial health inequality. And you probably, many of you heard about, for example, the pulse oximeters. And it wasn't the only reason, don't get me wrong, but it was one of the reasons why the number of black ethnic minority people in A&E, not in A&E, but in intensive care during COVID, with severe COVID in intensive care, was 25% when they represent 8% of the population. And that's because the pulse oximeters didn't work, because when they were designed, they only designed for white skin. And when I brought that up as an issue in the department, it was like, yeah, well, it's not a surprise, really. So my question was, what are we going to do about it? And that's why I then commissioned this report, which is now just reported back, fantastic report, Dame Margaret Whitehead, into looking at the racial inequity and gender inequity of medical devices. And the government has now accepted all those recommendations from Dame Whitehead. But there needs to be an international approach to that. And again, when we're talking about global health and helping developed countries, if you think about most of those people in those countries are not white, right? And so we've got to make sure that the healthcare things that we're looking at are the ones that impact them the most. Malaria was a good example, polio is a good example, but also there are diseases that we know of already that only affect people of certain ethnicities, and there's very, very little limited research on that. And I give you a good example where, again, I just thought of somewhere the UK made a difference. I met with, as health secretary, with the president of Kenya was over here. We went to Manchester University, because Manchester University, we had funded to do a research project with Kenyatta University in Kenya, where they were doing research into a particular type of skin cancer that only affects black people. It was the first time this research had been done to this level. We had developed a new treatment, and it was already saving lives. And we were here to we were gathering the UK to mark the next phase of research. That's all funded by the UK, through our global health program. So I think in this space, we just got to think of more ways to, when we develop new drugs and life science products and stuff, that they are inclusive of all people, regardless of their racial background, whatever that might be, and they are really practical things that can be done there, right? So a gentleman there mentioned the pandemic treaty. I remember in my discussions at the WHO when we were there to talk about the pandemic treaty, another thing we also led on in terms of preparing for the next pandemic, but also more broadly for disease control, was having more diversity in clinical trials. And there's work in the WHO that the UK has led on that, and encouraging companies, actually forcing them in some cases by regulation, to have much more racial diversity in their clinical trials for obvious reasons. And then my final point on that is that, just to link it back to something I said earlier, I think AI is just going to be so huge in healthcare, and we've got to be really careful that when these models are being trained for AI as they are right now, that they're inclusive of data, as much data as possible, of people of all ethnicities, of all genders, so that those outcomes can be used for everyone. And right now, they are definitely, there's no question, there are AI companies and stuff training their data in a sort of lazy way on data they can easily get their hands on, but they're not actually thinking, how can we make this inclusive for everyone? And we've got to be certain of that as well.
Yeah, maybe I'll take the soft power piece. I guess one of the things that came to mind when I was thinking about that question is that and maybe it's more of a hard power dividend, and that's when the UK and others, including the Gates Foundation, invested in institutes like the Jenner Institute or the Oxford Vaccine Group. We did so with the idea that those institutions would be able to make vaccines for countries that were facing diseases that don't necessarily affect rich countries, but are still hugely prevalent in poor ones. those investments early on, about 10 years ago, ended up being really important in order to actually make a COVID vaccine. It was one of the things that that AstraZeneca was able to do rather quickly. So that was I think an early investment where usually when you think about investments in innovation, there's a kind of trickle down theory of once you create something in a rich country, then it will find its way to a poor country. In this case, it was the other way around. The intent really was to try to support poor country health needs. Another example of that was some of the work that, again, we had funded through the Wellcome Sanger Institute outside of Cambridge, and that's to look at the genetic sequencing of malaria. Very successful effort, but that also turned out to be one of the backbone efforts that helped the UK develop a state-of-the-art system to track and surveil COVID, and it was really a gift to the world because the UK was the leader in a global surveillance program to really track where the epidemic was going because of something that was an investment that was made on an entirely different thing. So I think these are the kinds of things. I really do like your point about the Georgian peanuts and the hope that we could somehow quantify a bit more. I think anecdotally, when I talk to friends who work at GSK, or I talk to parents whose kids want to come and study in the UK, it's because there's not just a commitment to public health, there's a commitment to global public health. And by the way, I wish we'd get rid of the global term. I wish it was, more people would finally realize this idea that there's global health and then there's our health. It's crazy. COVID definitely taught us that. So I do feel like, there's some of these dividends that I wish we could quantify a bit more.
Let's do another round of questions. I'll come to you first in the third row.
Thank you very much. Ollie Ryan Tucker. I have a quick question about something in the report. The report mentions biogenomics and biodata. And so I know at the moment there's a lot more concern being raised about how hostile states might be capitalizing on biogenomic data access. So obviously in the US that's a big issue at the moment. So I'm curious as to how we manage that kind of risk without shutting out international collaboration that we all want to see happen.
Thanks. Other hands, just in the middle there. And then, yeah.
Thanks. Jake Canterbury from Atticus Partners. One of the successes of the UK life sciences industry is the startups based around either educational institutions or government institutions. But one of the issues with kind of UK startups across the economy is that funding is not necessarily available and they're looking elsewhere, particularly America. Do you think this is a particular threat to the UK life sciences industry? And do you have any ideas of how we can prevent this from happening?
And then just one more here, and then I'll come back. Great.
Thank you. Mike Salem from the Consumer Choice Centre. The report highlights the need for cross-government cohesion. So Sajid, you, I think, aptly mentioned the role of AI, which I think is very important. One big force in British public health is the NHS. So my question is, where's the balance between AI and our systems? Would you replicate the current NHS system in other countries around the world, or would we tweak it a bit to cater for 21st century challenges? Thank you.
And I know this is pushing it, but we're running out of time, so I just want to go to Donna at the back in the middle. Yeah.
Hi, good afternoon. My name is Donna. I serve in Defence's Strategic Outreach Group, which their mandate is to preserve civilian life in conflicts. It's kind of connected with the NGO community in conflict zones. And my question is a bit of an observation, really. In the defence space, we see kind of the global trajectories about working together with other allies that have shared values and sort of dividing up the world and our capabilities. I'm wondering whether in the global health space we do that well enough. Do we work with our allies and those that share values to divide up problem set so that you can do more in small amounts of places rather than spreading ourselves too thin?
Thanks, Donna. So we've got about 5 minutes doing no justice at all to those questions. One on managing data, the role of startups, cross-government cohesion, and the freshest question of all, which doesn't need repeating. Who would like to go first?
Shall I go?
Yeah, please, thank you.
Well, on data protection, obviously it's a more important issue than ever before because data is what's going to feed these AI learning models and things, and that's essential if we're going to get the benefits of that. And it's right that we look at better ways to protect that, and that's why when I was health secretary, I commissioned a report that was called Data Saves Lives, and it's out there as public report. It's, yeah, in fact, I launched it here in Policy Exchange offices. So, and it's there's a lot in there about, especially around NHS data, because the NHS has the biggest sort of set of health data of any single organisation in the world. It can bring a lot of benefits if it's used properly, and so I won't repeat that, but I'll just say have a look at the report. On finances, the gentleman question about the finances, and that's not just an issue. It's right, the observation. It's not just an issue with health, life sciences sector. And I think just generally, especially in the tech space more broadly, it's an issue. It's a long-running issue. I mean, the UK is good at raising sort of venture funding. It's good at raising large amounts of capital. Biggest capital market in the world is still here in London. But it's not so good in that sort of what's often referred to in industry parlance like the Series A, Series B type of financing. There are a number of initiatives that are in play to improve that, especially in getting sort of the pension industry involved more in that. I think the US is always just going to be far ahead of any other country in this. It's just got a much more liquid market, a much bigger set of investors, private equity investors and others. But even if the UK can secure a position as number 2 to that, we'd still be in a fantastic position. And I think there are things happening that will help with that. Would I replicate the NHS anywhere else? No, I wouldn't. I think it's as a universal healthcare system, it tries to do a lot, but it's failing on a lot of accounts in terms of outcomes. I won't talk about all the reasons why I've written about it, I've talked about it, but I think there's some fundamental flaws in the NHS model. I think the Australian model, for example, is a lot better. I'm not saying it's perfect, but it's a lot better than the NHS model. And I think whichever governments are in office for the next few years and stuff, they really need to tackle that issue and be honest about some of the challenges that the NHS is failing and why so many people are queuing for things they really shouldn't have to. And yeah, the point about allies, working with our allies, yeah, definitely. I mean, I think in government, I've seen so many examples of where we've teamed up with other like-minded states or organizations, like the Gates Foundation has been fantastic at this. A huge amount more can be achieved. And going back to the UK's convening power, I think we're very good to get people around the table and do just that.
Julia, I want to give you the final word, so I'll come to you next, Joe, let me. You first, Joe, that's right.
Oh,
yep.
Sorry. Well, maybe on the defense, I'm glad that was raised. I do feel like it's an important constituency. It's an important voice in this. And again, I think CGP has been great bringing together some national security experts. I think about people like Peter Ricketts. I forget the American general it was who, on the eve of a vote where the U.S. was considering cutting its aid budget, said, if you cut the aid budget, you're going to have to send me more bullets. Because I think what he was trying to say is that development is an important part of the defense diplomacy development 3D strategy, and so I think that's certainly something that we welcome in terms of getting unlikely voices to really speak up on the importance of this issue. The other thing I think is really critical is some of the work that through the defense industry, some of the innovation that's come out of that. And I think of DARPA. Which is a fantastic advanced research program that the U.S. started, that ARIA, a new program here in the UK, is attempting to replicate. Those are the kinds of things I think that should be really welcomed, and I think will help maintain the UK as a center for excellence, a center for innovation. Again, hopefully with the support of a wide constituency beyond just some people like me who are talking about the pros of and the benefits of aid.
Thanks. Julia, final word.
Oh, thank you. Just to pick up a few threads and really to hopefully leave people with some things to keep mulling over. I'm very taken by what was said about defence and collaboration and all the rest of it, and having chaired, for example, the Global Partnership for Education, which at the end of the day was getting people to pool their funds. I completely endorse the perspective you've put. But I think we've just got to pull out a tension in the room, which is, if we're going to try to sell overseas development aid to communities on the basis that whatever the UK equivalent of, Georgian peanuts are feeding the world, then that does imply a degree of kind of flag planting, which is not necessarily a way of then building cohesive cross-allies, cross-donor interventions. There's a tension there, and I think we've got to be, very clear about the, costs and benefits of the tension. You might be able to avoid the tension if you're dividing things up and saying you do this and I'll do that, but if you're coming together to pool funds, and given the scope of many of these challenges you need to, then that kind of flag planting is very difficult. So we've got to be thinking about what's the right balance between the community cell and the most effective way of delivering aid. I'd also, on the policies of healthcare in other countries, I mean, healthcare systems need to be responsive and bespoke to what is happening in those nations, and I think we've just got to be a little bit careful however we run our healthcare systems, the NHS or the Australian system. We're dealing with populations that have where much of the health burden now arises because of long lifespans. There's the set of issues around ageing, there's the so-called lifestyle diseases, the things that come from obesity, from tobacco use, alcohol use, all the rest of it. In many of the places where we're talking about the need to build out healthcare systems, they are not the challenges. The challenges are quite different. You're talking, malnutrition, not obesity. You're talking infectious diseases still killing tens of thousands of children, whereas that's not something that happens in the UK or Australia with our vaccination rates and the like. So they're different challenges, and systems have to be structured differently. And then I just pick up finally on the AI point, because AI will enable us to do a whole lot of new things in healthcare more efficiently and effectively than we ever have before. But there is a challenge to think about in terms of some of the big AI-generated platforms in healthcare. I mean, the big contemporary one was when DeepMind released the protein folding technology to the world, which is now available for all researchers, and the use of AI has sped up our understanding of protein folding and therefore the research. But that was DeepMind made that available free of charge for researchers around the world. They didn't have to do that. They could have monetised it, in which case it would be available for those who could pay for it. Now, that won't be the only big AI platform that really matters for research. So what are we doing now to potentially think about and convene non-profit actors, whether they be governments or philanthropies, potentially in some form of partnership with the private sector, to generate other forms of AI health research platforms at no or minimal cost. And it's not the first time the world's had this debate. When the human genome was being sequenced for the first time, there was a discussion about whether that should be done by the private sector. Ultimately, it was done by global collaboration, and around a third of it was sequenced by Wellcome Sanger. But then it was all put together, and yet, you could Google it up in a minute if you wanted to. But it could have gone a different direction. People got the global commons working to make that a global public good. So there's a set of questions for all of us about, are we getting the global commons working now to make the AI set of public goods that will really matter for the future of healthcare equitably available?
Thank you very much. So lots to go away and think about, but we are at time. So thank you all very much for joining us. Please stay and enjoy the refreshments. The cinnamon rolls are particularly good if you need any extra encouragement. I'm really grateful to my colleagues Ted and to Zoe for writing the report. Please do take one away with you. If this is your first CGP event, please sign up with lots and lots going on, so you're always very welcome. And finally, could we thank our extraordinary panel for their time today.